Preparing and administering intravenous infusion, intravenous IV insertion, is a procedure wherein a vein is fractured through the skin by a cannula to provide venous access. Purposes. First is restore and maintain fluid and electrolyte balance. Next is establish a route for intravenous medication. Materials needed: IV fluid, IV infusion set, IV tubing, IV cannula, tourniquet, antiseptic swab, IV pole, hypoallergenic tape, betadine, spleen if needed, clean disposable gloves. Assessment. Assess the patient need for IV therapy by checking the vital signs, laboratory values, urine output, skin turgor, and breath sounds, and the conditions of mucous membrane for the rationale. This will identify abnormalities related to fluid and electrolyte imbalance. Next is assess the arm and hands for the potential insertion site. For the rationale, careful assessment on the insertion site will avoid inserting a catheter in the potentially dangerous site. Next is assess the patient's tolerance of IV therapy by escalating breath sounds, monitoring vital sign, laboratory values, urine output, and neck vein distension. For the rationale, the presence of crackles diminish urine output, distended vein, and signal complication of IV therapy. Next is check for factors such as anticoagulant therapy, bleeding disorder, and low platelet count. For the rationale, this factor places the patient risk for bleeding during IV catheter insertion. Next is verify the doctor's order, check the IV solution and medication, compute and make IV label. For the rationale, IV fluid must be ordered by the physician. For planning, wash hands and maintain asepsis throughout the preparation. For the rationale, hand washing deters the spread of the microorganisms. Preparing and assemble the necessary materials and procedure IV tray for the bedside. Next is check the sterility and integrity, the IV solution, the IV set devices. After that, maintain the aseptic technique when opening the sterile package of the IV solution. Clamp the tubing and cap the spike and insert into the entry site on the bag or bottle as manufacturer direct. These structures seal the IV bag or IV bottle. Squeeze drip chamber and allow it filled at least halfway. Next is, I'm going to remove the cap at the end of the tubing and release the clamp and allow until the air bubbles have disappeared. Close the clamp and recap the tubing, maintaining sterility of the setup. If an electronic device is to be used, follow manufactured insertion and instruction for tubing insertion. Good morning po. I'm your student nurse for today. May I ask po na, what is your name po? Okay po, thank you. For this procedure po, this is a proper identification to ensure that I'm going to perform the procedure for the correct patients po. Okay po. I'm going to have the client a lower forward position on the bed and the place in the arm in the dependent position. So, ma'am. Next is, I'm going to select and palpate appropriate site, the accessible veins. After I palpate the patient, if the site is hairy and agency fallacy permit, clip the hair with a scissor. After that, next is I'm going to apply the 30K 4 to 6 inches above the manufacturer. May I ask, ma'am, to open your hands, ma'am? Another, ma'am? Another? Okay, ma'am, thank you. Next is, I'm going to wear my clean gloves to protect the spread of the microorganisms. So, after wearing my gloves, next is I'm going to cleanse the anti-site with an antiseptic solution into the circular motion. So next is, I'm going to use my non-dominant hand, place about 1 inches or 2 inches below the entry site to hold the skin taut against the vein. Can you close your hand, ma'am? Next is, I'm going to skin gently enter the dominant hand by 20 to 30 degree angle. Next is, I'm going to remove quickly the cap of the IV tubing and also attach into the needle. After the procedure is done, I'm going to dispose the materials that I'm going to use. Especially, I'm going to dispose the gloves that I'm going to use during the procedure. After that, I'm going to use alcohol to sanitize my hands. Because hand washing is very important to prevent the spread of the microorganism. And after that, I'm going to put the materials in the proper place. Evaluation. Monitor the IV site and flow rate hourly while IV fluid is infusing. For the rationale, this document client response to the infusing. Next is evaluate the patient tolerance to IV therapy. For the rationale, to note if the IV is infusing well at its desired flow rate. For the documentation, chart the date and type of the insertion, the gauge type of the catheter, the location of the insertion site. Next is document the type and rate of IV fluid infusing. The last is note the patient tolerance to the procedure.